All right, this is going to be a post-isometric for your levator scapula. So if I have involvement on my right levator scapula, the first thing I typically recommend is going to be a mobilization technique. So I'm just holding an elongated, so I'm just holding post-isometric relaxation.
Now, let's do a post-isometric relaxation stretch for the levator.
All right, this is going to be a post-isometric relax. All right, this is going to be a post-isometric relaxation technique for the levator scapula specifically. So typically with a levator injury, what I'm wanting to do first is going to be to mobilize the tissue after we've ruled out any severe sort of All right, this is going to be a post-isometric relaxation technique for the levator scapula. This is a progression based off of establishing adequate mobility. So typically you want to rule out any significant or severe sort of trauma. From there, if it's mild, you can work on a mobilization technique. That would typically look something in the lines of like an isometric sort of elongated position, just getting the tissue to remodel in an oriented fashion. From there, once the pain has started to diminish, you can start working on loading the tissue. So a post-isometric relaxation technique is going to be great for that. For this, what I want to do is I'm going to go into that same position that I was in for the mobilization technique. So if I have involvement on my right levator, I'm going to look over towards my left pocket, down towards my left pocket. I'm going to get the same hand on that side. And now I'm going to elongate the tissue. So I'm going to provide a little overpressure here. And then what I want to do is I'm going to actively start to drive my head back into my hand, starting out at about 20%. So what I'm actually thinking about doing is I'm thinking about lifting my head up in that direction, straight up in the diagonal of my pocket. But the thing that's stopping me is my hand. So I have my hand that is matching the resistance of my head, but my head's given about 20%. I want to start out conservatively here because I don't want to strain the tissue or overload it. So I'm going to start here 20%. If that feels really like nothing or very mild, I can go 25, 30, 35, 40, and then right from there, you're going to reach the percentage of tension where you feel activation and you feel like it's definitely doing some work. That's really where you want to stay. So anywhere typically starting out, typically I would recommend anywhere between 25 to 40%. Starting out, you're going to hold for about 15 to 20 seconds. You're going to rest, shake it out, give it about 30 seconds. Do another set, 15, 20 seconds. You can go upwards of 3-4 sets depending on the session and what time you have. But I typically recommend doing this about 3 times per day at minimum. The more you can get it, the more you can facilitate recovery and adaptations. But minimum effective dose is going to be typically around 2 to 3 times per day, about 2 sets at about 2 to 3 sets of 15 to 20 seconds per session. And that is going to be your post-isometric relaxation technique for your levator scapula.